hospitals are under enormous pressure. This is the same in Tasmania, South Australia, New South Wales, Queensland and Victoria. Enormous pressure. This has been something no one has ever seen before, the growth in demand in our hospitals. Why it is hard to know, except that there is some evidence that some sort of delayed reaction to COVID, but there is huge numbers of people coming through the doors.
I'm Dr. John Wakefield, the Director General of Queensland Health, and I would like to thank the committee for the opportunity to provide the following opening statement. In 2021, there was a 15.4% increase in public emergency department presentations compared to the previous year. And that's on the background of a population growth of less than 2%. During the same period, there's an 11.2% increase in patients requiring resuscitation or critical care, so the more severe end of emergency care. We also recorded a 6.9% increase in emergency surgeries compared to the previous year. And all indications point to these pressures continuing this financial year. For example, between July and October 2021, our public emergency department presentations increased again by 6.6%. Those requiring resuscitation or critical care jumped by 9% in that same 4-month period compared to the previous year.
Thank you, Member Palmerston. Member for Moraney, over to you.
Yeah, thank you very much. What I wanted to ask was, we talked earlier on the open statement about increases in certain issues with health, mental health and everything else. What else have we seen as far as when we rolled out the vaccine? Has there been people presenting with more issues over that with the vaccine injuries or conditions or symptoms that are arising out of those vaccines that are probably making the system a little bit more cumbersome and overloaded?
Thank you. Professor Keith McNeill, Acting Deputy Director General Prevention Division and Chief Medical Officer. The short answer to that is no. We have seen no tangible impact on our health service delivery other than, obviously, prevention of COVID by vaccination. So they haven't caused any negative effects in terms of health system demand.
Member for Moraney, did you have a supplementary?
So we're actually seeing no increase in myocarditis or pericarditis or stroke or blood clot?
We have seen occasional presentations, but they're very rare and they certainly don't add significantly to the demand on the health system.
Member for Moraney, anything else?
Well, I was just going to say, do we keep... I keep getting people calling me up in my electorate saying they're having issues with it, and there's a lot of presentation, but there doesn't seem to be much said about the situation. I'm just wondering if there's any information or any statistics kept about how this is actually working, because I've had both of my uncles, one of them's had a stroke, and there's been a lot of people I know in Mackay that have suffered adverse reactions here. And it doesn't seem to be being mentioned too much anywhere around the HHSs, that's all.
Perhaps if I can just add that the place to go for the data on the AEFIs, or what they call as adverse events from immunisation, is the TGA website. So the TGA publish the data on the significant complications where they do exist from or adverse events from immunisation. But as the Chief Medical Officer has said, in the perspective of impact on our hospital system, it's negligible.